Okay, so we were in the middle of talking about anaphylaxis when the audio cut out of the first uh, uh, presentation that I made. So, um, systemic anaphylaxis uh, is caused most of the time by bee stings or injections of antibiotics or serum. So, but there are many other things that will cause anaphylaxis as well. So peanut allergies are one of those things that can really cause a massive allergic response. Even a very small amount of the peanut allergen can cause anaphylaxis. So I don't know how many of you do much flying, but if somebody has a severe peanut allergy, they essentially remove all the peanuts from the entire airplane because somebody sitting 2 rows ahead of the person eating peanuts can cause an allergic reaction, an anaphylactic allergic reaction in that person several rows behind. And it's the result of a sudden, massive release of chemicals into the tissues and the blood. And these chemicals act very rapidly on the target organs, causing essentially the loss of an airway because the air passages swell up so quickly. Okay, so let's talk about how we do testing on people for these particular allergens. So as an example, we have something called the radioallergosorbent test, or RAST, and it measures levels of IgE to specific antigens. So the person is tested by using an antigen, typically injecting it under the skin, and uh, the amount of IgE is measured. There's also a tryptase test, which measures the enzyme tryptase, which is released by mast cells, and it increases massively during an allergic response. So if you look for the presence of that enzyme, that's highly indicative that you're having a mast cell mediated allergic response. Differential blood counts, which is a very standard kind of a test, can also be extremely helpful. So if you are doing that differential blood test, where you're looking at the different levels of white blood cells, if you see a huge increase in the number of basophils and eosinophils, which are the two white blood cells that are part of the whole allergic response, then that gives you a pretty good indication that you are, in fact, having some kind of an allergic response going on. And the leukocyte histamine release test measures the amount of histamine that's released from the patient's basophils when they're exposed to a specific allergen. And again, that's looking at the drug which is starting the whole cascade of this allergic response. Okay, so we had talked about the wheal-and-flare reaction, and this is the picture that I was talking about. So if you look at the picture of the person's arm, you can see that in this particular picture, there are 4 sites where a person has been challenged with a particular allergen. The wheal is the raised white area. Okay, so this is the localized allergic response. The flare is that redness that's all along the bottom of the picture. So you can see that not only has the local area responded, but it's sort of moved away and had a more general reaction in that area. Okay, so that's what a wheal and flare looks like. Okay, so the skin testing is an in vivo method. It's done in a live person, and it's basically designed to detect precise sensitivities. And this is kind of a safe way to determine if you would likely have an anaphylactic response. Okay, so you inject a small amount of the antigen into the skin, and it could also be a scratch, but typically it's an injection. And if you see a wheal and flare response within 20 minutes after the challenge, it's indicative of a histamine release. So now you know that you are allergic to this particular antigen. And then you measure the diameter of the wheal, and that basically tells you how allergic you are. So it gives you an indication in a fairly safe way um, how allergic you are. And of course, somebody is there with epinephrine or some other drug that will help if, for example, the person, even with this tiny amount of allergen, um, has any kind of anaphylactic response. This is done in a medical facility. And so if a huge allergic response happens, they have the ability to deal with that. Okay, so how can we block this allergic response? Okay, so the primary way is taking drugs that essentially block the actions of the lymphocytes, the mast cells, or the chemicals that are produced by these cells. Um, Antihistamines and Allegra and all of these other anti-allergy medications are looking at blocking some aspect of this allergic response. Okay. Obviously, it would be best if we could completely avoid the allergen. Okay, in some cases, we don't have control over that. You can't really control when a bee is going to find you and sting you. But if this is something which is perhaps a food-based allergy, so peanuts or shrimp, or shellfish, I should say, um, these are things that you can, with a great deal of effort, make sure that you are not exposed to. So again, telling an airline that you have a peanut allergy and having them clear the peanuts. And usually they make an announcement, if you happen to have any peanut-based foods with you, please don't eat them because you're liable to cause this horrific response. Like was shellfish, that tends not to be something that, breathing somebody else's breath when they're eating shrimp, that doesn't tend to cause an anaphylactic response. You actually have to ingest it in order to get that. So in that case, you can just be really scrupulous with the ingredient list of anything that you eat. And then there's another method called desensitization. And this is controlled exposure to the antigen through ingestion or sublingual absorption. So you take something and you stick it under your tongue and you allow it to absorb in your mouth very slowly. Um, or in some cases, getting allergy shots. So you actually are exposed to the allergen repeatedly, and the idea is you basically desensitize the body by continuous repeated exposures to that particular antigen. Okay.